back to A Cup of Joe, where we talk about healthcare topics that concern us these days, or at least are in our mind's eye. So the first thing we've talked about in the past, but just kind of to go back over, is there have been some significant changes to the funding for the Medicaid program in the United States. And the intent was to reduce the amount of money spent on the program, and in particular to reduce the amount of money spent on folks that in the eyes of some might have the ability to get a job and obtain health insurance on their own. So we're going to talk a little bit about what changes have come about by virtue of that, with that goal in mind. So the biggest change that was made is a work requirement. So if you are able to work, meaning you're not disabled, and you're between the ages of 21 and 65, so the kind of the traditional definition of able to work, you're an adult and you're not disabled and you're not pregnant, then the requirement now has been established that you demonstrate that you are working or you are seeking education, and there is a certain number of hours you have to work per month or seek education per month in order to be entitled to Medicaid benefits. This is only applicable to the 37 states that have expanded Medicaid. So states like Texas and Florida and others that chose not to expand Medicaid, this doesn't apply to them. For the states that did not expand Medicaid, however, there still are some changes that have come about. Most notably, more stringent requirements to demonstrate your eligibility for Medicaid. So if you're in a non-expansion state, take Texas, in order to be entitled to Medicaid, you have to be under the age of 21, over the age of 65, or pregnant, post-pregnancy for a period of time, or disabled. Now, those eligibility requirements, in particular for the ages of 21 to 65, have been made more stringent. So you have to demonstrate that your disability is continuing. You have to demonstrate that you are still poor in order to be eligible, because Medicaid is for the folks in the United States that are poor, but based upon the definition that's adopted in each state. So in Texas, it's not entirely clear how this will affect people, but the intent is to reduce the number of people that are on the Medicaid rolls and reduce the amount of money that we spend on those people. So we'll have to see kind of how it rolls out, because obviously there's going to be different organizations that are going to work hard to try and help patients retain their Medicaid eligibility, despite the different efforts that are being undertaken to reduce the Medicaid rolls. Associated with an effort to reduce Medicaid has been an effort to reduce Supplemental Nutrition Assistance Program, or SNAP benefits. It's the same concept. There is the opinion of some that there are people that are drawing these resources that don't need to. They could get a job and make money and pay for their own food. And that program the funding has been reduced in a lot of ways. As it relates to both of these things, these efforts to Oak Bend, we're not entirely clear exactly how it will affect it, but if the theory holds out, fewer people will have Medicaid, which will make a safety net hospital such as Oak Bend's world more difficult, because we'll have fewer paying patients. And we're trying to navigate around this by involving more folks in helping people to retain their eligibility, which would otherwise fall by the wayside by virtue of a lack of follow-through on the administrative responsibilities. When you look at it from a community standpoint, I think it's little understood that a lot of folks that are drawing benefits out of the Medicaid program are benefiting society by maintaining their ability to participate in society instead of becoming a total drain on society. But it is not well understood how that works, and I probably don't have enough time to explain that in the course of this video. So all I can tell you at this point is that as changes happen, we adapt. We will adapt to this change, and there are other community organizations, charitable organizations, that will step in to try and help out where they can. I look forward to seeing you on Another Cup of Joe very soon.